So colleagues, after that short pause, that break, let's now spend a few minutes to focus on how do we domesticate STISA. If we agree it's really relevant, it is aligned with the SDGs, with our African Agenda 2063, our national vision statements, our national development plans, and is a relevant policy framework because it addresses the 6 priorities agreed at really high levels of governance. How do we get this framework out there and working for Africa and the African people? I just want to start by proposing the notion of national domestication, and then discuss different institutional arrangements, not institutions, but institutional arrangements for national domestication. Very briefly introduce monitoring and evaluation approaches to national domestication, and then end by suggesting some questions and potential case studies for national domestication of STISA, with emphasis on monitoring, evaluation, and learning. Now, the concept of domestication is not common in policy research literature, particularly literature on STI, or literature on innovation policy, or even R&D policy. It's a concept that's largely used in international politics, international relations, and international law. You'll find the concept of domestication of policy or treaties or regimes in general in international politics, literature, international relations, international law. So we talk of domestication of the SDGs, domestication of international conventions, such as the World Trade Organization agreements, those relating to trade, intellectual property, property protection. We talk of domestication of the African Continental Free Trade Agreement. The concept is largely used when discussing treaties. Very few cases that I've come across using the notion of domestication, which I think is useful, because it largely means bringing home. So you bring home global treaty or global agendas, continental agendas, continental policy frameworks. You bring them home to your own country. You negotiate them at those high levels of governance within the UN, the African Union, or even within the regional economic communities, the RECs. But you have to come back. You have to bring them to your own country in a very organized way. You have to domesticate them. So bring home is very important, because if you don't bring them home, you don't have local ownership. Not all citizens go to Addis or go to the UN General Assembly, or go to different treaty negotiation processes within the World Trade Organization or the environmental conventions such as the Paris Agreement, or even the World Health Organization, where we are seeing a lot of negotiations now taking place on how you use different global frameworks, policy frameworks to collectively address the COVID-19 pandemic. So you bring home to build local ownership. If there's no local ownership, it's going to be very difficult to implement this global or continental frameworks. In our case, for purposes for focused on STISA. So domestication is the concept we should be using, which is a more stronger approach than just talking of implementation, because domestication means that you have to build domestic measures within countries at different levels in the countries to be able to implement the STISA strategy. And the processes of domestication will vary depending on their policy cultures. Some countries will actually have very specific plans and programs for implementation of STISA. Some will essentially say we are going to have these objectives, STISA objectives and priorities written into our national programs. And leave it at that. Some can go further and even have legislative instruments. So I'm proposing that in our reflection on STISA is that we start emphasizing this domestication, bringing it home. It's my considered view that STISA is not being brought home. It's not in many countries. As we discussed during our webinar last week, very few of citizens and policymakers know about this very important policy framework, STI policy framework. But very few even know about Agenda 2063. And without domestication, we are not going to see much out of STISA or see much happening on Agenda 2063. The number of important principles that guide national domestication of treaties or policy instruments, such as policy framework, such as STISA. And first is the explicit recognition by parties involved, and in this case by African Union member states, that they share challenges and problems. That must be explicit in the minds of countries, the minds of Africans, that the problems are common, that they are shared, whether they are dealing with the food insecurity problem, priority 1 of STISA, or the priority 2, the health-related, the huge disease burden, the COVID-19 pandemic. These are common shared problems. If you address them in just one country, you will not achieve sustainable development in the other countries. If you don't address the peace or living together, it is a priority. If you still have pockets of wars, instability in some countries, you'll not achieve sustainable development. And I can give you many examples. The conflicts in the Horn of Africa, the conflicts in countries such as Mozambique, the conflicts, intra-conflicts in some countries, Chad, take away resources, common resources. They distract the continent. You can't trade as a continent. You can't exploit the comparative advantages held by those countries. Some of those advantages are actually mineral or just big populations, big markets. But those opportunities are not easily accessible or honest because of conflicts. So this recognition is important, that the problems are shared. So no country can do its own, can work on its own. Climate change. If you live in Mauritius or Seychelles or whatever, if South Africa does not reduce emissions, you are going to suffer as Seychelles or Mauritius. If climate change impacts are huge on those island states, South Africa's economy is going to suffer in many respects. And your national systems are not going to, systems of innovation are not going to be strong. Then also recognition that you have differentiated responsibilities and capabilities. By differentiated responsibilities, I mean that you have these shared problems, but you have to allocate your responsibilities depending on your capabilities. Some countries are more capable than others, and they need to take on certain responsibilities to do certain things, to promote science and technology, governance of science and technology, promotion of innovation, governance of innovation. Some countries are likely to and are capable of entering into the fourth industrial revolution, starting deploying certain technologies early enough. And I think they should have some responsibilities to share those capabilities with others. So the notion of differentiated responsibilities and capabilities, so actually the principle is an important one. You'll find such this principle in many international and now many treaties, regional treaties. For example, the principle is well articulated in the UN Convention on Biological Diversity, the Paris Agreement, and it has to do to a large extent responsibilities and obligations to transfer technologies, to share information, to share skills, to share knowledge. It's your responsibility. Those of us who are following the complex global public debate now on relaxation of intellectual property protection, so that poor countries in Africa or around the world can start manufacturing vaccines, will come across this principle being invoked. You have certain responsibilities, but not that all countries have responsibilities. But they're just differentiated. For example, African countries are now exercising their responsibility to share information to share data from sequencing of the virus genomes, and we can only know that this kind of variant is in that country if that information is shared, so that you actually innovate. You design vaccines if you've been producing them. So differentiated responsibilities and capabilities is very important. The other principle is one of trust, and I talked about this in our last webinar. You trust other parties in the African Union, other countries in the African Union, that they are committed to the vision, mission, objectives, and the green objectives of STISA. You must trust others that are going to do their bit. If you don't trust them, then forget about STISA. If Equatorial Guinea says, I'm going to host and finance the African Observatory of Science, Technology, and Innovation, Austria, you have to trust that that country is going to fulfill its obligations. That is, it is going to exploit its differentiated capabilities to meet its obligations. So trust is a very, very important principle guiding national domestication of STISA, then you countries must be prepared to transfer some measure of their national sovereignty to some super national body. In the case of STISA, countries should be prepared that while they are going to be taking decisions, actions at national level, some measure of sovereignty and authority is going to be transferred to the African Union, the Pan-African Parliament, REX, to monitor and evaluate national implementation. That we're going to use various peer review or evaluation mechanisms to know who is fulfilling their obligations, who is committed, who is investing resources to address these common challenges. So transferring a measure of national sovereignty and decision making to some collective, which could be a regional economic community such as SADC or the East African Community or ECOWAS, is very important. So that whatever you do at national level, you also required at the regional and continental levels to report on. Without countries' flexibility to transfer this national sovereignty and authority to be monitored and evaluated, it's very difficult to implement STISA and any regional programs. And when we have our next discussion, we'll then start addressing the issue principles. Are these principles being recognized? Are they being articulated in any discussions of implementation of STISA? If not, how do we promote them? Then institutional arrangements for national domestication of STISA, I think you have different groups. I've just suggested 4. You could actually have 5 here, depending on where you put private sector. But more important, you have executive bodies, executive authorities, your ministries of science and technology, the Prime Minister's office, ministries of health, for example, if we are dealing with the priority 2. These are executive bodies. If they don't know about STISA, they're not committed to these shared challenges. If, for example, ministries of health say they're not going to do anything through the African Union, STISA proposed kind of mechanisms on priority 2, they're not going to work through the African Center for Disease Centers for Disease Control, ACDC, or they are not going to work through the African Continental Free Trade Framework. If national actors decided they are not, then you forget about STISA. So you require executive leadership from possible the presidency, the Prime Minister's office. So the question that I keep on asking myself these days, and sometimes I even try to do some monitoring and evaluation, how many African Prime Ministers and or presidents know about STISA or talk about STISA? How many ministries of STI or ministries of health talk about STISA? Do we have executive bodies that are promoting national domestication of STISA? Then you have very important legislative bodies, national parliaments, local assemblies. As we discussed again, I think last Friday, some of these that legislative bodies are very critical in resource allocation, in budgeting, in monitoring and evaluation. They also actually make decisions that are about implementation of STISA. One example I can give you is the priority around communication, not just fiscal infrastructure, but mobility. If your parliaments make laws that restrict mobility of funds and engineers, then you're going to be undermining the attainment of that priority. It is a priority on communication of mobility. And if you are parliamentary portfolio committees, STI portfolio committees, not know about STISA, they're not going to allocate resources to your Department of Science and Innovation or Ministry of Science and Innovation or your commission to do anything about STISA. If they know that we have STISA and they value it, they're going to give you as a ministry or department or commission responsible for STI resources to domesticate STISA. Then in some cases, if you have STISA embodied in national legislation, then you could actually use laws, courts of laws to domesticate STISA. And then let me end by suggesting that civil society and NGOs are very crucial for domestication of STISA. And I would add in this group, sorry that I left it out, private sector enterprises, which you define civil society largely to be that sphere where non-state actors meet with the state ones. The private sector falls in there, and private sector is a key actor in implementation of STISA in various ways. We are dealing with intellectual property protection, digital transformation, vaccine manufacturing, and so on. As we discussed again, private sector is to a large measure the locus of innovation. That's where technologies are commercialized, diffused for economic and social purposes. I'm going to quickly end, and we'll have Dr. Conte lead a discussion for at least an hour on monitoring, learning, monitoring, evaluation, and learning. And some of you at the business monitoring and evaluation to determine whether such a policy framework is relevant, whether it is effective, whether it is being implemented in efficient ways, whether there are specific outcomes, and use various tools that will show you what are the measurable outcomes. We use log frames. In some cases, these days, you develop theory of change, but you must have a plan for implementation. So one of the challenges that we have to confront with STISA, which is a challenge that we noticed with even national STI policy frameworks or regimes, is the absence of plans, implementation plans, or where they exist, not much is done because they don't have very clear measurable outcomes, or the capacity for monitoring, evaluation, and learning is inadequate. I want to refer you to one of the recommended readers by Susan Boras, which is about organizational capabilities and policy learning, how countries learn in different ways to actually design and implement STI policies. But Dr. Conte is going to talk, he's going to lead us in a good discussion on monitoring, evaluation, and learning, with emphasis on experiences around R&D surveys, innovation surveys, various national efforts through is called the African Science, Technology and Innovation Indicators Initiative, ASTI, which was established by NEPAD. I think launched in 2008 under the leadership of a number of countries to have a collective approach again to conducting survey, sharing information on STI trends, expenditure on R&D, innovation activities, and so on. Every now and then over the years, not really frequently, what's called the African Innovation Outlook report has been produced, which essentially an effort to bring together different countries, innovation, R&D and innovation surveys, so STI surveys, giving us a sense of who is investing how much in R&D, in new technologies, in innovation activities, and addressing some of the societal challenges. So I think we have three. We have three innovation outlook reports, African innovation outlook reports that have been launched over the years. But a number of countries have national reports, STI reports of different kinds. Some countries almost on annual or biannual basis produce R&D survey reports. At the global level, we also have reports such as the Global Innovation Index that try to benchmark African countries in terms of innovation. The Global Innovation Report is produced by the World Intellectual Property Organization and a number of actors. And over the last 10 years, particularly the last 5 years, African countries are being considered there. So it's a ranking of about 145 countries and shows you where, in terms of innovation, again, innovation defined as we did as the introduction, development, introduction, procurement, diffusion of new processes, new practices, and the different global innovation reports focus on different themes. But the most important is that they look at this from really a systemic perspective, where they look at the institutional actors and the interactions among the actors, the quality of policies, the articulation of public-private sector actors. Then in terms of, again, monitoring, evaluation and learning, you have a number of independent reviews being conducted by a number of international actors, such as the United Nations Conference on Trade and Development, UNCTAD, and UNESCO. In a number of countries, or for a number of countries, UNCTAD has conducted STI reviews. Ghana, Ethiopia, Uganda, Angola, Lesotho. There are reviews that are ongoing for Zambia and Botswana. And these are available. The review for Ethiopia was published. Also, the Uganda one is also was released towards the end of last year. But these are very important monitoring and evaluation processes, which enable countries to do their monitoring and the assessment of or reviews of the effectiveness of their STI policies, or the dynamic nature of their national systems of innovation. The OECD has done some reviews which have focused on, at least one has focused on South Africa. And then in some countries you have actually national reviews. South Africa has had at least two that I consider to be very useful self-evaluations led by through the minister responsible for STI in the past. So I want to end our last module with that. Again, we'll have a more focused discussion with cases and on the 15th. And the questions that we are going to be asking are how well is STISA mainstreamed in your national frameworks, STI policy frameworks, the national vision statements? Is there explicit reference to STISA? Are the 6 priority areas accommodating? The objectives very clear? Do you have mechanisms to monitor? Are the different institutional actors involved, and how well are they involved? And what are the challenges to the national domestication of STISA? The principles well articulated and recognized at national level. So thank you very much. I look forward to continuing these discussions. Thank you.